Are mental health issues in youth possibly linked to HD, anger, anxiety, depression, etc.?
So 90% of the country is anxious, me being one of them. 90% of the country also experiences depression and anger and different things. Those are what I like to call symptoms of life. But when you are from an HD family, live within an HD family, are connected with HD families in any way, those are also feelings and symptoms that come up a lot. Now, whether it's directly correlated to maybe someone who's also at risk for Huntington's disease, whether it means that they're actually having symptoms of Huntington's disease, if someone came into our clinic, we would never diagnose them if they had anxiety and depression with Huntington's disease. That with Huntington's disease, you need to have more than just a symptom or two symptoms like anxiety, depression. We need to see other things going on as well. But I will say that supporting someone with Huntington's disease does start at a young age, and having anxiety and depression and anger and irritability when you are from an HD family is normal. There's lots of changes going on. There's lots of adapting and adjusting. Just when you thought everything was stable and going well, life throws you a curveball and things happen. So those are normal symptoms. I would not jump to, oh my gosh, they have Huntington's disease. But those are symptoms that reach out and get support for, whether that's they get therapeutic support or medication support or a combination thereof, or maybe they go to an at-risk support group if they're at risk, or they go to some of the youth support groups that are out there. There's lots of resources out there. So I think it's a common symptom. Is it due to Huntington's disease symptomatically, clinically? Maybe, probably not. Is it due to living in life and living with Huntington's disease in their life? Yes, and it's important to give them support and help that they need. So that's a great question. Thank you.
I think I'll also address this when it comes to juvenile onset Huntington's disease, because I think as a mama, and if your kid's at risk for HD, you're always looking for something, right? You're looking for potentially the first symptoms, and is this something, and they trip or drop a ball, or they're struggling in school, or they're having behavioral issues. Again, as Lisa pointed out, there's the impact of coming from a family with HD, having HD, being at risk for HD, and the kind of heavy feeling of walking around with that responsibility. There's also hormones and coming of age and all the stuff that just rage in us, right? It's a difficult time. And our bodies are funky, and we're just trying to figure them out as we're growing up. You want to allow for that kind of natural funkiness too. And so if there's anything that becomes a pattern or more consistent, or things that are starting to accumulate, it's not just one thing, but it's many things, then you need to seek an evaluation from someone that knows about HD and JOHD. But it's a very complicated diagnosis, and there's a lot to go into it, which was not your question, but I feel like it had to be talked about.
Fantastic. So there are two questions here, but both related to dystonia. So I'll read them both because they're a little different, and we can go from there. So the first is dystonia, chorea, rigidity. Are they all related? Does movement turn into stiffness? So obviously mentioning dystonia here, but then also can we just explain dystonia and what can be done to address it and the pain that accompanies it?
All of them are abnormal movements or movement disorders. And I think about movements on a spectrum. Chorea's usually addressed as one movement, where it's what we call hyperkinetic. It moves a lot, abnormal movement, right? Rigidity is tightness or stiffness. And dystonia is abnormal twisting or posturing of a body part or parts. And so they're distinct entities, yet on a spectrum of things that and they're treated differently because of that. So the question was about dystonia in particular. Dystonia can happen at any stage of the disease. People think about it as this disease becomes more advanced, but I would say that we see some kind of spectrum of it throughout, and it can involve a neck, it can involve an arm, it can involve a leg. It's definitely more prominent and common in juvenile onset HD, but it happens across adult and juvenile. It can be treated with medications that relax the muscles, which can be also used to treat other symptoms of Huntington's disease. So we try to look at the whole package, right? What are all the things that someone's experiencing? Let's say it's anxiety or mood changes plus movements. Is there something that we can use for both? So we're not having lots of different medications on board. A great treatment for dystonia if it's bothersome. So mind you, you don't always have to treat symptoms. You treat symptoms that are bothersome to the person. I always say, I don't really care if it bothers anyone else in the room. I could care if it bothers you, right? Because sometimes Chorea bothers a significant other, but it doesn't bother the person. And it's not getting in their way of doing things that they want to be doing in terms of, and it does not impact quality of life. So you need to take that on into account. So if the dystonia is impacting the individual, if it's uncomfortable, if it's painful, you can treat it with Botox, which is a great treatment for dystonia because you can target specifically the muscles that are involved and not have to take a medication that affects the whole body. It has potentially more side effects.
I don't think I have much more to add. I will say, I guess the one thing with dystonia that I do tell my patients is that in the case, for example, with Botox, typically it works really well if it's like specific kind of muscles or body parts, like one at a time. When we're talking about the entire body, or if there's certain areas in which, targeting those muscles could cause weakness or their risk, we have that conversation with the families. And the medications at the same time, just to be frank, the medications we have for dystonia, in my experience, I think that they're a bit hit or miss. I just want to be very honest. We have really good medications for the Chorea, and the Chorea in particular, but when it comes to dystonia, it's a little bit, if we have to take a medication, again, there's a lot more side effects and it's a little bit more complicated. I think the Botox ends up being one of the most effective, but then we do have to be thoughtful as to what is the body part that we're targeting. And then with rigidity, and that's a part of why we always really encourage patients to also have a local neurologist that can do, because that's something we cannot access via video, unfortunately. One of the things is that sometimes it could be a side effect of some of the medications we use for the Chorea. So we always have to keep in mind to what extent is it part of the disease itself, is it dystonia, or is it a side effect of some of the medications that we're using for Chorea or the mood symptoms too. So it's a quite loaded, and difficult question, but that's the part of seeing a movement disorder specialist, at least in person, every so often. And particularly when you start noticing these things, is really, if it's pain, that's exactly why we will want to see, a reason to see someone in person.
With the one that was asking about what can be done about the pain, are there things outside of medication, whatever, maybe massages or maybe certain physical therapies maybe? I'm just trying to maybe elaborate on that.
Yes, absolutely, yes. Physical therapy can be really helpful. And actually, when you go to physical therapy, depending on what is the muscle, what is the concern that you have, actually a therapist will do a targeted massage, and I would argue sometimes better than if you go to a regular spa, actually, because they're very intentional and focused on what is the muscle and what needs to be addressed. But yes, I think physical therapy, we love physical therapy. It's incredible the things that they're able to do and identify that you would not think of. So that's one thing. The other thing that I think that there's starting to be a little bit more evidence for are things like acupuncture. Actually, there's a little bit more. I think for a while there was a question of what was the efficacy of it, but particularly for pain, it is really helpful. We talked about medications, but we're trying to think of things outside of medication.
Stretching.
Yeah, good range of motion that you can do with your loved one. So massage is range of motion within the limitations of the individual. You can set up their environment so it's conducive to their body, right? And their body position and what feels comfortable. Some people get really creative, right? If there is dystonia of a limb that rubs on a wheelchair, pool noodles are awesome, right? And it really kind of protects against any injury there. So you can get pretty creative with those types of modifications.
It's so funny because pool noodles have been like a subject of conversation, and like our support groups of putting it behind the toilet tank, of like putting it along the whole length of the bed frame, and it's like dollar store, right?
Pool noodles and duct tape.
Yeah, it's sweet. Yeah, you can go with different colors, and it's been really useful. Okay, so I have HD. I have always been able to cry, but now I have emotions that would make me cry, but the tears do not fall. Is this from HD?
We're struggling with this one.
So I will say, and I am not a doctor, I will admit to being on depression meds, going through all sorts of things with my brother. And that, for me, is what changed the most. It was that I was not able to cry, and then I felt like it was all stuck inside, like I couldn't release it. So obviously, not a medical advice here in any way, shape, or form, but if there is any medications that may be intervening.
So medications can definitely blunt your emotional response and drive, but I will say HD does that, right? And it doesn't mean that you're not feeling it or experiencing it. It just you might not be able to share it, express it, have the facial expressions that socially cue your loved one that you're sad or angry or understanding that they're frustrated with you, right? And it might take longer for you to meet people where they're at, right? So there's a situation unfolding, you're in a heated discussion, someone's getting emotional in front of you, you're realizing it, you're sensing it, you're feeling it. It just might take time for you to respond to that as well. So it's not that you lose the ability, but the regulation around it makes it more challenging. And having loved ones know that and have insight and patience and awareness can be really helpful, because it's not that it's not there and you're not feeling it. It's just hard to get it out.
I worked in hospice for many years, and one of the concepts that we talked about was internal weeping. And I believe that even with limited ability to express, that those emotions are happening inside of our body. For those of us who can clearly show those, it's more external and visual. If there are like key words or statements that you have with your family, friend, caregiver that help them know that you are feeling or you're not feeling as much and you just need reassurance, develop those. They're almost like your safe words, because otherwise I think it can come out in different ways in some of those emotions that are less socially recognized and acceptable.